Yeah, I'm Dr. Upendra, Senior Consultant Urologist, KIMS Hospital. Today, we will come to know why some people complain that their sexual desire is very low. This is also called libido. So, if you come to the causes of this reduced desire or libido, there are multiple causes. Nowadays, you can see that everybody is stressed. So, the first and foremost cause is stress or anxiety. So, because of either work stress or any stresses in and around the home, so that leads to our financial causes. So any of these things definitely affects the sex center. So automatically what happens is the sex center in the brain is the main one which controls the whole of the sexual mechanism. So once there is any change in the brain, there is a lot of chemical changes and hormonal changes which leads to reduced sexual drive, and that leads to impotence. This is a physiological impotence, we also call. And nowadays, a lot of people are suffering from hypertension, diabetes and other things. So these also, the drugs which we use for these conditions can also affect the libido, and sometimes the sexual drive can go down. So we need to be very cautious what drugs we are using. And suppose you have a desire, probably we need to consult the doctor and change the drugs. And prolonged diabetes also can lead to reduced blood flow, reduced nerve sensation, and that also can lead to reduced sexual activity and desire. And another thing is, some of the hormonal conditions also lead to this problem. A lot of people nowadays I am seeing, they are having a lot of hypothyroidism, that is thyroid levels are very low. This, if undetected or untreated, can lead to reduced desire, reduced sexual performance. So that needs to be addressed and needs to be treated. Apart from this, some people can have primary testicular failure. That means during the development, the testis may not develop properly. That's called hypogonadism. So in those patients, because of the hormonal deficiency, they can have less amount of desire or libido. Apart from this, some people have hyperprolactinemia. There is a condition where there is an excess production of a hormone called prolactin. That also can lead to this type of reduced desire. So such patients needs to undergo an MRI, which can tell us there is any pituitary problem or anything. So that requires a surgery. Apart from this, there are some other conditions where patient can have reduced desire, like patients on psychiatric drugs. They may be having depression, anxiety, etc. So those patients also can have reduced desire, and that can lead to impotence or reduced sexual desire. So the foremost cause is physiological, that means anxiety. And second thing is insomnia. Some people do not sleep properly in the nights. That also can affect your sexual activity, and that can reduce the desire. So these are all the common things which causes the reduced sexual desire. And sometimes the drugs which we are using can lead to reduced sexual desire. So be careful. Any elderly patients on treatment for prostate enlargement also can have this reduced desire. So you need to talk to the doctor, and the drugs needs to be changed.